Good evening, everyone. I'm Dan Faulkner. I'm the Registrar and CEO of the Royal College of Dental Surgeons of Ontario. And with me is RCDSO President Sandy Venditti. I want to welcome you to our second online member town hall. I appreciate that you're taking time from your very busy schedules to hear directly from me and from Sandy and from our Assistant Registrar Andréa Foti and some current council members on some very important topics today. As part of the registration for this event, we collected postal codes to gather data on the representation of the attendees for tonight's event. The majority, not surprisingly, are from the Greater Toronto Area, but we also have attendees from across Ontario. And I know in the future, we are going to be focusing on how to ensure that what we are doing at the Royal College of Dental Surgeons of Ontario is available and accessible to all dentists across the province. As always, our aim is to keep you informed and, of course, to address the questions that are on your mind.
So to begin, as RCDSO President, I'd like to recognize the complexity and privilege of gathering online today by sharing a digital land acknowledgement adapted from Adrian Wong of Spiderweb Show in Ontario. Since our activities are shared digitally to the internet, let us take a moment to acknowledge the legacy of colonization embedded within the technologies, structures, and ways of thinking we use every day. We are using equipment and high-speed internet not readily available in many Indigenous and marginalized communities. So we invite you to join in acknowledging our shared responsibility to make good of this time, and for each of us to consider our roles in reconciliation, decolonization, and allyship. Thank you.
First of all, I want to thank everyone who responded to our request for questions in advance. Sandy and I will try to answer as many of those as possible in the next hour. But to get started, we'd like to ask you a question. So we're going to be using, again, if you attended our last RCDSO Connect, the software called Slido, and it allows you to easily express your opinion by participating in some live polls. So on your smartphone, you can use your smartphone, you can use your computer or your tablet, open your web browser and go to www.slido.com, and you can enter the event number, which you will see at the bottom of the screen, 0505852. You can also go to the QR code that will appear on the questions, and you will see the prompt that pops up will take you to the actual website for answering the questions that we're going to pose. So we're going to begin by polling you on a few issues this evening, and we'll start by asking you how many years you've been practicing dentistry here in Ontario. And we'll give you 30 or 40 seconds to open and respond. So if you look in the top corner, we can see about 23 people have responded, and we're seeing the distribution as it's calculating. Hopefully we can get a few more responses coming up. So we're up to about 47. So many of you are 20 plus years in practice. That's fantastic. Okay, so that gives you a little taste of how this will work. It looks like, as I said, there's about, it's going to shift as I talk, but about 70% or so are greater than 20 years in practice. So really a lot of experience in the crowd tonight. Why don't we move on then to the next question? Are you following us on Twitter and Instagram? So you have a few options here: Twitter only, both, Instagram only. So we'll give you a few seconds again to respond. So we've got about 60 people. No. Wow. 70 people. So we'll talk a little bit more about this as the evening progresses, but really thank you very much for the poll participation. 92% of the 75 who've responded are not following us on either. I really want to encourage everyone to think about your use of social media and following us on social media. We provide a lot of our updates that way. We provide updates on issues like COVID-19 guidance, and we post answers to a lot of commonly asked questions that we receive in our practice advisory area. We also actively monitor what's being talked about and chatted about on social media so that we can see issues where we may need to provide clarification or maybe where we need to gain new insight on some of the issues. So thanks again for participating. We will have polls throughout the evening. And with that, I will pass things back over to Sandy.
Thank you, Dan. So I'd like to share a few highlights from our June 16th council meeting. We had a very full agenda with issues ranging from the college's draft strategic plan to a proposed fee increase for 2023. Dan and I will provide some context on these issues now and also during our question and answer session later on in this evening. So for those of you who have read the council highlights, council supported a recommendation from the Finance, Property and Administration Committee for a proposed increase to the 2023 membership fees in the amount of $485. This recommendation was taken very seriously. A considerable amount of due diligence and discussion led us to this conclusion. As a reminder, our membership fee includes malpractice coverage, or PLP, professional liability protection. In light of the pandemic, Council held fees static in 2022, but with the rising costs of PLP and inflation surging to historic levels, it was necessary for us to make this adjustment. So the fee increase is primarily related to managing the PLP program and is a result of many factors, including the increased costs of insurance and allocations for future payouts. In 2021, PLP accounted for 31% of the college's expenses, and it has been our biggest area of cost growth for the past 5 years. College staff work very hard to control budgets in all areas of the college. However, increases to PLP are driven by external forces and are out of our control. So in order to give you some context, only 2 other provinces, Alberta and Quebec, include liability coverage as part of their annual fee. The other 7 provinces require dentists to obtain malpractice insurance through a third party. So for example, the college's current liability cost per member is $680 per year, compared to Quebec at $1,375 annually and Alberta at $1,415. Private coverage starts at approximately $2,100 annually. So even with the proposed increase, we are still the lower cost option. The bylaw changes for the fee increase will be circulated to members later on this week, and we welcome and look forward to your feedback on this issue. Council also discussed the college's draft 2023 to 2025 strategic plan, which is based on consultation and engagement with council, staff, membership, and external stakeholders. You will have seen an email last week inviting you to participate in another consultation on the draft plan. Andréa Foti, Assistant Registrar, will give a more in-depth update on this topic later on in the program. So before passing things back over to Dan, I wanted to provide you with an update on a consultation from the Canadian Dental Regulatory Authorities Federation, CDRAF, which is the provincial dental regulators. So they are seeking input from stakeholders on a draft document which sets out competencies for the new dentist. This will help ensure that dentists across Canada are held to consistent standards and accountabilities related to their clinical skills and professionalism. The college's response congratulated CDRAF on the draft document and offered some comment on informed consent, boundaries, taught and tested or shadowing, and pedagogy. Council approved the response and supports the efforts of the Federation. Dan?
Thanks, Sandy. I'm going to focus some of my remarks now on a topic that I know I've heard from many dentists in the province about: COVID-19 guidance and the revisions that the council and the college are considering currently, and some information on an additional consultation that's taking place on issues related to fallow time and closed operatories. On June 16th, as was mentioned, council met for a full day, and council was updated on the college's plans to review the current COVID-19 guidelines with the aim of releasing revised guidance at the end of June. This week, the college is releasing streamlined, updated guidance to ensure that expectations for dentists are clear, proportionate to risk, and reflective of current practices. The guidance will focus on precautions that are most important for patient and public safety, and they will also reflect some of the important new developments that have taken place and that have been communicated over the last few weeks. That includes the lifting of general mask mandates, the revocation of the Chief Medical Officer of Health's directives, the introduction of new public health guidance from the Ministry of Health and Public Health Ontario, and new evidence concerning best practice for infection prevention and control in dentistry. So please watch out later this week for an email from the college that will have more information about the revised guidance. Last evening at the executive committee, a much more streamlined version of the guidance was approved. And at the council meeting, council was updated on our plans to look more specifically at fallow times and closed operatories. I just want to go back a little bit in time over the last few months. In March of this year, the oral health colleges, so that includes dental hygiene, denturists, and dental technologists, consulted with a panel of experts, including 3 infectious disease specialists. And that group evaluated the existing requirements at that time for aerosol mitigation, including fallow times and enclosed operatories. And at that time, the panel advised the college to retain the existing requirements. This summer, because of the changes that I mentioned earlier, we are consulting again with an expanded group of subject matter experts, and that will focus specifically on the requirements for fallow time and closed operatories. And that's given the nature of the evolving pandemic that you're all aware of. Our existing requirements for fallow times and enclosed operatories have not been modified as part of the guidance that you will see this week, and they will remain in place. But we know that this is a very important issue for all of you, and we're moving quickly and responsibly and trying to gather appropriate and balanced information on this issue. We're going to be speaking to British Columbia and Quebec. We're going to be speaking to the 2 faculties of dentistry in Ontario, and we will also continue to involve infectious disease experts. We're working also very closely with the other oral healthcare regulators to ensure that we do not contribute in any revised guidance to confusion between health practitioners at the practice level. So you'll be notified when we have an update, and we are moving fairly quickly with the broad group that we're working with. And we want to make sure that we provide a very responsible response to the issues that many of you have raised with Sandy and myself and other members of the college. So for more information on our June council meeting, please visit our website, and you can read about our council highlights, and you can also watch a recording of parts of the council meeting on the college's YouTube channel. Sandy?
Thank you, Dan. So we'll now move on to a presentation from Assistant Registrar Andréa Foti, focused on how the college develops standards and guidelines, the work underway to consolidate our existing policies, and the resources available to members and the public. I'm happy to introduce Andréa to give you an update. Andréa?
Great. Thank you so much, Sandy. And hi, everybody. Thanks for joining us. I'm going to touch on a few issues in my talk tonight. I'm going to keep it fairly brief. If we could just go to the next slide, Angela. Thank you. Got a couple polling questions for you, just trying to gauge when do you contact the college and where do you go for information when you have questions that you're grappling with in practice. And then I'm going to talk a little bit about the different resources the college has. You'll see throughout my slides what I'm hoping to really communicate to you and convince you of, hopefully, is that the college can be a really critical partner to you in the work that you do every day. So I'll be touching on a few of those things. Next slide, Angela, please. Thanks. So first poll, when you have a question that you're grappling with in practice, do you contact the RCDSO? So we'll just kind of wait for you guys to get your phones out. Seeing about 44 responses. Sort of wait a little bit to allow more of you to participate if you're so inclined. But I'm really pleased to see that, you know, roughly 70% of you are saying that that you do contact us, which is great. Obviously, we hope to get that number up, and I'll talk to you a little bit about what we have to offer. Great. Looks like we're sort of plateauing there more or less. So thank you very much for that. Got one more question for you. So for those of you who said that you didn't come to the RCDSO, where do you go when you need answers to questions? This is really critical for us because, like I say, you know, helpful for us to understand what you consider to be a key sort of resource or key partner organization. So lots of ODA Facebook, online forums, CDPA, okay. Great, online colleagues, yeah, that's terrific. Okay, your lawyer, yeah, understandable, that makes sense. This is really helpful information. You know, part of, in thinking about tonight's presentation, part of what we want to be able to do is sort of understand your needs as best we can, and to really figure out how do you navigate critical issues. So this is incredibly useful. Yeah, ODA does have, they do have a lot of resources. They're great folks. We partner with them quite frequently. Okay, so a longer answer here. When you've contacted the college, haven't found it too helpful. Okay, sorry to hear that. Hopefully we can work on that. Yeah, this is great. Okay, so lots of Googles, lots of ODAs, OAO, public health, understandable, of course, given our current climate. That's terrific. Okay, so thank you very much for sharing all of that. So what I want to maybe talk about here is what can the college have to offer? And I say that knowing that, you know, I've spent my career to date in professional regulation. And I am a regulated professional as well. My background's in law. So I know that registrants don't always think to contact the regulator when they do have a question. We're hoping to turn that a little bit and to really position the college as a key resource and a key information partner for you. So why should you contact us? What do we have to offer? A couple points here. We have up-to-date information. We really keep our eyes on the horizon in terms of developing issues, both at the government level, in practice, and of course, we've been doing that throughout the pandemic with respect to COVID. We do have a whole host of resources that are directed to you as dentists to really try to assist you in managing various aspects of your practice. So right now they're called, we have on the screen here all the different names that we call them. I'm going to talk in a couple slides about efforts that are underway to try to streamline that. But we've got standards, we've got guidelines and practice advisories on a whole host of topics. And then I hope you know this, I think maybe some of you do, but we also have a dedicated team, our practice advisory service, comprised mainly of dentists who are there to answer questions for you In many instances, I know that they field questions on different standards and guidelines, so that if you've consulted one of those and you're not sure about how it applies, they can sort of talk you through that. I know they answer a lot of questions about just different practice issues. They've also been a key resource that we've used at the college to try to respond and give all of you the best information we have about COVID, and as the different requirements and public health restrictions have changed. So they're an incredible resource. So if you don't know them, please do consider getting in touch when you do have a question, because they really are phenomenal and a very talented group at assisting you. Next slide, please, Angela. So we communicate resources in a number of different ways. Obviously, our website has a whole host of information, and I know some of you indicated that you do come to the RCDSO website. We've just undergone our website refresh, so it's a new look and feel. A lot of hard work's gone into from our comms team, making it more user-friendly, more intuitive in terms of where information is located. So that's a key resource. We will email out to the whole profession or segments of the profession when there are important updates, and you will have seen that over the course of the pandemic. We've used e-blasts in particular as a key tactic. Sandy touched on this a minute ago, but following our council meetings, which are 4 times a year, we put together highlights. Council meetings, in case you didn't know, they are open to the public. So certainly if you're interested, you can attend in person when we get back to in-person meetings, or you can join us online in our YouTube channel. But certainly if you don't have time or space for that, you get a summary out that's released a week or so after those council meetings, so you know the key decisions. And then, like I say, our practice advisory service is another really key resource that's there to answer questions. So going back a little bit to our guidance, so those are the standards that we have, and a whole host of other resources. I wanted to touch a little bit on what goes into developing those documents. There's a number of things on screen here. And I'll say that these steps really pertain to when we're developing brand new guidance for the first time on a new issue, or if we're reviewing existing guidance that we have in place. So certainly we want to make sure, in terms of research, we want to really understand the best current information that exists. So if there have been developments in the topic, if there's literature that's developed, we also want to understand cross-jurisdictionally, what are other regulators doing on this topic? Can we learn from them? Can we, be informed by their experiences? So certainly research is critical. Consultation is a critical part of our guidance, and we often will consult on draft guidance. In some instances, like our strategic plan, we will go out very early before we even have a draft document to get advice and input. So stakeholder feedback drives the guidance and how we develop it. Our RCDSO committees and council, of course, there are decision makers. So we really rely on those groups to give us detailed feedback on the guidance, how it may play out in practice, things we need to be thinking of. And those committees and council are comprised of both dentists, representatives from the 2 faculties of dentistry, and members of the public who are appointed by government. So it's quite a balanced group. We look to external authorities and resources. That really is part and parcel of the research that we will do, but certainly we want to understand if there are thought leaders in the space, if people are doing good work on this topic, we want to really understand what they've done and how we can learn. In some instances, and Dan's touched on this when he mentioned COVID, we will put together a small panel of experts and really dig into their expertise on more technical matters. COVID's a great example, but we have used experts in other standards as well. So the two that come to mind would be our infection prevention and control standard and our sedation standard, very technical areas that we want to make sure we are learning and being informed by experts in the field. And then Dan touched on this, where it's possible, and COVID is a really good example of this, we have been collaborating with our partner colleges in the oral healthcare space. So the College of Dental Hygienists, Dental Technologists, and Denturists, to make sure where possible and where it makes sense, we have alignment so that there's no confusion, just understanding that oral healthcare is provided in a team setting with different professionals. Next slide, please. Thank you. So I touched on this a little bit ago. One of the pieces of work that is underway, and it was started under our current strategic plan, but it will extend beyond this year. We really want to look at, and have started to look at, the resources that we have for dentists to do a couple of things. I think certainly we've heard from some of you through our strategic plan consultation and some of the members of our council that the standards can get a little bit complicated. They're long, they're very dense. I think that was really in an effort to try to give very detailed feedback and direction, but it comes at an expense of having a very lengthy, sometimes 20-page, 25-page document. We want to see what we can do to make those documents more accessible for you. I've spent part of my career in standards development and policy development, and certainly my sense has always been that very few people are reading a standard cover to cover. You're coming to those documents if you have a question. We want to really make sure we're being informed by that, and we can make those documents as useful to you as possible so that you can get what you need and then get back to caring for patients. So we're working to consolidate our standards and resources to really trim down the different categories that we have. There's not really appreciable differences between a standard and a guideline and a practice advisory. So we want to really consolidate those into standards and then resources. So FAQs and other things that are going to be more practical. We'll continue to incorporate best available data and evidence into that work. And like I say, really looking at the type of language we use, how we present that information for you, how dense those documents are so that we can make them as accessible to you and as useful as possible. So certainly watch the RCDSO site and any notices for consultation going forward, because I'm hoping that once we get through some of the COVID guidance that we've been dealing with, as Dan mentioned, we're going to be able to turn our attention much more back to standards and resources, and we'll be consulting on those as we have those ready. So speaking of consultation, I've mentioned that consultation plays a really critical role in our process. And when I talk about consultation, what I mean is we have draft documents that we will invite a whole host of stakeholders to review and give us feedback on. It's an open, transparent process. So we will include all of you in that process. So you'll get notices for when we're consulting on documents, and you're able to review those and give us feedback. We include the public and a range of stakeholder organizations, both in dentistry. So for example, the ODA is included in every consultation that we do, and also public organizations. We promote any open consultations through a number of channels. You can see those here. We do have a dedicated space on our website where you can go and learn about what consultations are open and available to you to participate in. We have been also looking at ways to make the consultation process more streamlined and easier for everybody to participate in. So we've been experimenting with developing short surveys where we can ask very focused questions and give people options of multiple choice and true and false, as well as some text space where if you have more ideas you want to share and you want to write a sentence or two, you can. But it's really in an effort to try to make the process as easy as possible. We really appreciate how busy everybody is, and everybody's time is so overloaded at the moment. So we want to do what we can to really encourage you to continue to participate in the process. So we'll continue to experiment with surveys, but certainly any feedback we get informs the final document. So every single piece of feedback that we receive, we review, we consider how we can incorporate any of the suggestions made, and it always improves the final document. So what can you do? Really, I guess here, I would encourage you to continue to engage in any consultations we're running. We had an incredible response earlier this year when we did a consultation on our draft strategic plan. Earlier, I think it was around February, end of January and February, we went out before we even had a draft strategic plan and really asked big picture questions. And we were thrilled with the rate of response. I believe, I don't have the stats right in front of me, but I think about 95% of our overall participants were dentists, which is incredible. So thank you. If you're included in the folks who participated in that process, thank you so much. Your feedback helped us develop the draft strategic plan that's currently out for consultation. And it's really important for us to hear from you and get your ideas. So I would really encourage you, anytime we have something that's open for consultation, please consider giving some of your precious time to us and share your thoughts. So the current strategic plan, there's a draft that is out. As Sandy said, this was approved by council a couple weeks ago. This is what the front page of it looks like. And it's an open consultation. It is available for comment and participation until July 22nd. We do have a dedicated page on the RCDSO website where you can get information. If you don't have your eBlast email handy with how to participate, you can certainly go to our website, and really encourage you to take a look and give us your thoughts. So what's next in terms of the strategic plan? Well, as I said, the consultation is open till July 22nd. Certainly after that, we will be looking at all the feedback that we receive, and we've had a really good rate of response so far. And then over the summer, the balance of the summer, we will be thinking about how we can revise the draft strategic plan to respond to feedback that we've received. And then a final draft will go forward to council at its September meeting for final approval. So I'll just maybe finish there by saying, I hope I've been able to share with you a little bit more of what the college has to offer. Some of the plans that we have in place to try to make our resources more useful for you and really position ourselves as a partner for you when you have questions or you have needs. So hopefully I've convinced you of that. But in any event, thank you so much for your time. And I'm going to pass things over to Dan.
Thank you very much, Andrea. What I want to talk about now is some work that the RCDSO is doing with respect to service standards, and I'll explain that in a moment. I know that you saw the theme for this evening, that we really wanted through Andrea's presentation to talk about some of the ways in which we can help and support dentists in their practice with some of your questions that relate to practice issues or ethical issues. And we also want to hear about the important work that this college does as part of the dental system, the oral healthcare system. So you'll hear in a moment from some of our council members who will talk about why they're involved with the college. But I want to talk about service, and I'm going to start with a couple of polls first, very quick. How many times have you contacted the college in the past 12 months? So remember, you can use your QR code, take a picture. You can go to the website with the code. So we'll watch as the responses come in. So we're still a fairly low number. I think we have about 200 people in the audience. So we'd like to get that up a little bit higher. We're just over 50 now. And it's good to see that never has fallen to second. It was the first for a few minutes or a few seconds. So it seems to be holding fairly steady. We have about 70 people who've responded 1 to 3 times in the past 12 months. That's fantastic. Hopefully there has been some resolution to your question. Never 41%, so that equates to about 28 or 30 people of the 70. So a little bit higher than we had hoped. But thank you very much for those responses. Why don't we go to the second question? Are you aware that the college has a practice advisory team and the services that they provide? So take a minute to look at the responses. So we're hitting close to 70 people, and the top response is yes, but I do not know the scope of what they do. We only have about 4% of you so far who've said you're not even aware of the practice advisory team. But clearly we still have some work to do. If 57% are saying you're aware, but you don't know the scope of the work that they do, then we have some work. And I would bundle that under what we call service. Next slide, please. So what do we mean by this? We're often called a regulator, as we are, and what does a regulator have to do with service or a service culture? And our goal is really quite simple. The RCDSO is committed to cultivating a culture of service excellence. We strive to provide seamless service to our stakeholders by providing the right information and support at the right time. To me, this is a critical aspect of building trust, confidence, and respect from the public, from the profession, and from our stakeholders. Next slide. So what are some of the things that we've done? And this is just a snapshot. It's not the entire work that's been going on at the college, but we obviously wanted to learn more about what service meant to you, the profession, but we're also looking at that in a similar way with the public. You'll recall, hopefully, on the annual renewal last fall, you were asked a number of questions. And I'll comment on those in a moment, but why did we ask these new service questions? We really wanted to provide an opportunity for dentists to share their comments with us about their interactions and their most recent experience with the RCDSO. We also needed to look for opportunities to improve that experience for you. If you're going to take time from your day to contact us by email or by phone, we want to make sure that it doesn't feel like a very arduous process, and certainly there's work going on to move towards the goal of a better service experience. We wanted to benchmark so we can track our progress over time, so we're measuring what you think currently, and as we move towards the better state, what that will look like. So we're really always looking at improvement and measurement. And we wanted to provide an opportunity for dentists to comment about the website, because that's our main gateway for information and service. Next slide. So what did we hear? Very quickly, what we heard from those who had both contacted us in the last year or even longer than that is that our service experience, or the service experience, was good, but we can do a lot better. You can see that about 64% of the entire membership said that the service was good to excellent. So we have a lot of work to do because there were many who thought that it was fair or poor or very poor. And so what are some of the things that we're looking at? Let me tell you first about what some of the key findings were. And these were themes. If you recall, we asked not only the number-based questions, the Likert scale, but we also asked for comments, and we got a lot. And I really do thank you for that. A lot of comments that came in about the RCDSO portal, that it wasn't intuitive enough, that there was a poor user experience, the design wasn't working for you, that there was some missing or broken functionality for what we were requesting or asking you to do, and so on. With respect to our facilities inspection program, we are aware that you've experienced long permit or authorization wait times and response times, and that there have at times been inconsistent and confusing information that's come back to you. And we've certainly been working quite hard with our facilities inspection team to look at the areas that we can and will improve. And with respect to our e-portfolio, it was hard for you to find information or to access or to log in to the site. There was limited support for you as a user. You weren't quite sure where to go to get your questions answered quickly. And there was some functionality that wasn't working for you. Next slide, please. So overall, there were some very clear comments, and you wanted to see greater access to staff, whether that's by phone or email or maybe even social media that I mentioned earlier. You want to see improved responsiveness from the RCDSO, shorter wait times to get a response, simplified methods to complete the tasks that we ask you to do as part of your annual renewal or otherwise. Clear, reliable, and consistent guidance from communications and from our policies. And Andrea spent some time talking to you about our work that's moving in that direction with respect to our standards and our advisories. And improvements to our website to improve the navigation experience, the search capabilities, the content that's on the website, and to make the information easier to find. And I want to speak briefly, next slide please, to just a few areas that we are working on. First of all, we are in the process of moving towards a live call answer experience. So we know that there is a need to really consolidate how you reach the college and your ability to get information when you reach someone and talk to them for the first time. I hope some of you, and maybe all of you now, will go to our new refreshed website. It went live last week, last Thursday. And it really is just a level above what we were offering previously in terms of the look, the feel, and the content. And yes, we can do more work, but we're very interested to hear your feedback. So please go to rcdso.org and tell us about that experience. We will continue to work hard to make sure that that is a key gateway for your information access with the college. And we're continuing to collect more data because as the college, the council, and the leadership of the college know, if we can't measure it, then we won't know what to do, how to improve the experience. And I want to talk briefly now, next slide, about the annual renewal process, because we did ask you to complete a number of new questions. And there are a number of purposes for the annual renewal. And I'll go over this fairly briefly, but I really do appreciate and want to acknowledge that we received some really great responses, and I'm really pleased with the profession in that it provided some really important data that we need to contribute to the oral healthcare system, because I know and believe that as a regulator, we are a very important part, one part, not the only part, but one part of the system that can help to create change and policy changes as a result. So we use the annual renewal to collect fees, as you know. We use it to collect statutory information that we are required to do by law. And so one example of that would be whether you hold licenses in other jurisdictions or with other professions. And we also use it to try to start understanding some aspects of dentistry practice, what your practice looks like, what kind of work you're doing, how much time you're spending in things like clinical versus research or teaching. And we use that to be able to contribute back to broader system questions that can help to really, on an aggregate level, not an individual level, but on an aggregate consolidated level, understand what's going on in the system of oral healthcare and dentistry. Next slide. And so there's a couple of uses for this. First, we are required to collect some information for the Ministry of Health. This is written into the legislation, and we collect it so that the ministry can populate a health professions database. And the ministry is also in the business of performing forecasting of supply and demand for various professions. So that's one concrete example of how we are using the information. And the second way in which we're using that information, as I said, is to really understand scope of practice. We can use that to see trends. We can see patterns in practice, where it's changing. We can definitely see demographics with sex differences and age and experience differences. And as I've mentioned, we can use a lot of that information to help inform system research, such as health human resources. Next slide. And so that I want you to know is a really important initiative of the college, that we need to ensure that we provide you with a service. If you're going to call us, then we need to be able to provide information accurately, in a timely way, and in a very responsive way. So I'm going to turn it back over to Sandy now to move on to the almost final stage of our evening.
Thank you, Dan. So as many of you know, this year is another election year for the RCDSO Council, and that process will kick off later on this summer. At the same time, you will also have the opportunity to apply as a non-council committee member. So both council and committee members play a vital role in public protection and lend their unique and important perspective and experience to guide the college's work. So before we start our next session, I'd like to ask you a question. So we'll have a poll up on the screen. And the question is, what are some barriers to getting involved in council or at the committee level? So I'll just wait for people to type in their thoughts on that. Okay, time, not winning, time. That's a big one. Don't know how. We're hoping to address that this evening. Distance to travel. Okay. I never answered. Volunteer. These are great answers. I see time as the biggest one so far. Hard to get selected. Training, age. Can't travel. Okay, this is great because a lot of our meetings are now virtual. Volunteer at the ODA. Okay, that's need a cooling off period there. Previous volunteer, don't know how. Okay. Okay, these are all excellent questions. And time still remains the biggest barrier. So we're hoping to address some of these barriers this evening and work on them going forward. So thank you so much for that. So we would want the profession of dentistry to be held in the highest regard. And as the regulator, the college is the lever for the reputation of the profession. So each of you can have an impact by serving as a council or a committee member. And they are both very important, yet slightly different roles at the college. So for example, if you are a member of council, your governance role is to provide high-level strategic oversight. So the focus here is on the big picture of the college's work, while the registrar focuses on the day-to-day operational issues. If you are a non-council committee member, then you would be involved in more specific issues based on the mandate of that particular committee. But in both instances, your job is to ask questions of management and consider the diversity of thought and varied experiences among your colleagues, both public and professional, in your decision-making. The college staff are really terrific and they serve as a valuable resource. And ultimately, the registrar and the CEO is responsible for the implementation of council and committee decisions. So joining us today to share their experiences and perspectives as current RCDSO Council and committee members are Doctors Nalin Bhargava, Richard Hunter, and Nancy DeSanto. So Richard, let's start with you. You will be leaving council at the end of this year and you will be missed. Do you recall what made you run for council about 8 years ago?
Thanks, Sandy. And good evening, everyone. In 2014, I was a registered dentist for 38 years. I was not ready for retirement, but wanted a new challenge in dentistry. I taught at the Faculty of Dentistry in Toronto, was involved in leadership roles with numerous dental organizations. At the time, I became increasingly concerned about the corporatization of our profession. I realized that I care about the profession and its future. It wasn't the fact that corporations were buying dental offices, but a number of corporate employed dentists told me that they were given minimum billings per month and shortfalls would have to be made up. My impression was that this transformation put profit ahead of professionalism, and it would demean our profession. There also seemed to be too many vexatious complaints made against dentists, and that a streamlined process for screening complaints should be instituted. I felt that as part of the group involved in the regulatory process, we could have an impact by acting in the public's interest, while at the same time guiding the profession in a professional and a responsible manner.
So you had mentioned, thank you so much for that, Richard. You had mentioned you wanted a challenge. Did you get a challenge these 8 years?
I absolutely had a challenge, and I wouldn't, say that there was anything negative about my experience. I think that the college really does act in the public's interest, but at the same time is taking great strides to bring the membership in as a partner.
Thank you so much, Richard. And your passion has always exuded in those past 8 years. So we appreciate all your work and your service. So thank you.
Thanks.
So moving on, Nancy, I have a question for you that is often asked by me, by colleagues of mine. So people in the middle of their careers have so many personal and professional responsibilities in your life that participating in college activities may not be at the top of their to-do list. And we saw tonight with the poll, time was one of the biggest barriers. So do you have any advice for individuals in this situation? Like how have you balanced your personal and professional responsibilities with your work on council?
Thank you, Sandy, for directing this question to me, and good evening, everyone. My advice for individuals in this situation is as follows. Never stop learning and challenge yourself to become a better person and learn new things such as the regulatory aspect of dentistry by participating in college activities. As we grow older, our responsibilities keep doubling. Maintaining a healthy personal and professional life is important. 3 ways in which I have managed to balance my personal and professional responsibilities with my work on council are as follows. Number 1, I have found that organizing my day and following a schedule helps me to have a stress-free day. Keeping track of my schedule and knowing the schedule of those around me in my personal life allows me to be in sync with them. It also enables me to give myself time to get things done, whether it be in preparing for a council or committee meeting or preparing a treatment plan for an upcoming consultation in my private practice. Number 2, communication is key in striking a balance between my personal and professional life and with my work on council. Having a support system at work and home has allowed me to meet the continuous challenges of life, fulfill my responsibilities at my dental practice and on council. And I'm never too proud to ask for help. Lastly, number 3, prioritize what's important at the moment. If you have an event or a commitment, be it in your personal or professional life, prioritize that in that moment. With this, you'll be able to find a balance and be fully present in that given moment.
That's excellent, Nancy. You speak about balance and maintaining, communication. That's something that a lot of us strive to do. And I like at the end where, asking for help. Everybody needs, a colleague or a support system. So do you have a close-knit group of colleagues, or who do you reach out to when you need help?
I have a few good friends and my mom. she's my best supporter of anybody. And sometimes they give a different perspective on life, which has helped me, balance work and life with children and events that children have going on in their lives. I can't do it without the help of family and friends.
Well, thank you, Nancy. You are a role model. Thank you so much.
Thank you.
So Nalan, as a newer member of council, I'm interested in how you came to put your name forward in the election in District 1. Is there anything that you would have wanted to know before you took that big step? And has a time commitment been difficult to navigate with your practice?
Yeah, well, thank you, Madam President. About 20 years ago, I was pretty involved in organized dentistry in the Ottawa Dental Society and the Ontario Dental Association. And then I kind of left organized dentistry and became fairly heavily involved in the charitable and philanthropic world here in Ottawa, sitting on many boards and volunteering for many committees. So gained some experience there, but came to the realization that, for us, myself and my wife are both dentists. Dentists has provided a great life for us. So I thought, towards the end of my career, it would be a good thing to volunteer for the RCDSO and run for election and try and contribute something back to the profession. So I decided to run. I had the opportunity to speak to our previous counselor from District 1, who was really helpful in filling me in on the job. And time commitment, I guess it's just budgeting. Just like you budget funds, you budget your time. So I think it's prudent to always keep some time to volunteer. And now that time for me is the RCDSO.
So Nalan, you come to us with a lot of experience. You have a very giving spirit that shows in your past endeavors here. And in terms of the experience that you bring to the college, how has the experience been for you in these past 2 years?
Yeah, lots to learn. That's all I can say, Sandy. There's a lot to learn at the RCDSO and how the place works. I think it's a process.
Yes, you're never bored, that's for sure.
Nope, never.
Okay. All right. So I'd like to move back to our more seasoned council member, Richard. So Richard, what is one piece of advice you would like to share with anyone thinking of putting their name forward for a committee role or for council? So the Richard of today, what would you say to the Richard that was running 8 years ago?
Well, I guess if someone comes into your new role as a council or committee member with the RCDSO, you'll usually have some preconceived ideas. But I would urge you to keep an open mind to the process. Participate, but listen to your fellow members and staff. Do your homework. Don't be afraid to voice your opinion respectfully. Working alongside of extremely competent staff, professional and public members has been very satisfying and rewarding for me. I strongly urge anyone who is up for the challenge of guiding the profession while acting in the public's interest to put their name forward to run in December's election. Self-regulation only works with your participation.
Very well said, Richard. And I have learned a lot from you. Listening is key, and you do learn from the colleagues around the table. Thank you so much for that.
Thank you, Sandy, and I've learned a lot from you too. Thank you.
So Nalan, not to put you on the spot, but I will. So following what Richard has just described, what would you like to tell your colleagues about your observations of council and the important role it plays in setting policy to protect the public? So many people don't really know how the process works. Can you speak on that, please?
Yeah, many people may not know how the process works. So yeah, there's some confusion there. And I think that can be best summed up by a question a colleague once asked me. And the question was, what is the RCDSO doing to help me run my practice? And so that's a good question. But the mandate of the college is to serve and protect the public interest, and they are committed to excellence in regulating the dental profession of Ontario, which begs the question, who speaks for the dentist? Like who covers the dentist's interest, and who is their union to say? And of course, that would be the ODA, right? So, you can see there's some confusion, some inconsistencies. However, I think the thing to note is the end goal for both groups, the profession and the regulator, is to provide first-class care for the people of Ontario, first-class oral care. Like the end result is the same, it's just different responsibilities. So, I've always asked myself, if we look at the statement, the role of the RCDSO is to protect the public interest. Well, the question should be to protect the public from who or from what? And, that can take many forms, but for instance, in the last a little while, it could be to protect the public from the coronavirus. And so I think this brings up another important point. The RCDSO is the regulator for the dental profession in Ontario, but also a resource for the dentists of Ontario. So, during the pandemic, the job of the RCDSO was to instill confidence in the public of Ontario so they feel free to go back to the dentist. So getting the regulations right were so important, making sure they're accurate, making sure they're correct, making sure they're research-based, and then communicating it effectively to dentists. So get the information right and get it out. That's the job of the RCDSO. And I think that helps both groups. And so here, I think some inconsistencies become consistent.
Very well said. The most important part is to know your role when you are on council or a non-council committee position. Once you start with what your roles and responsibilities are, you know what the mandate is, protect the public. Very well said, Alan. Thank you so much for that.
Thank you.
So Nancy, let's close this session with a question that may help inspire others to consider putting their name forward this election cycle. So why did you feel it was important to join council? And what has been your biggest takeaway from your involvement with the RCDSO?
Thank you, Sandy. We all have a vocation. I was called to a life of service very early on in my life. At the RCDSO, we serve and protect the public. Two underlying themes I have identified through my involvement, both as an elected council member and previously a non-council member, are as follows. Number one, the health, safety, and well-being of the patient is always a priority. And number two, the establishment and enforcement of standards of practice and guidelines are there to maintain public confidence and trust in our profession. I felt it was important to join council so that I could share in the responsibility to act in the best interest of the public by providing a voice in the development of standards of practice, regulations, and guidelines for our members to follow. My biggest takeaway, I'm most impressed with the collaboration that exists among college staff, the public, the profession, and all other stakeholders. The advancement of patient-centered oral health care and regulatory excellence is the common thread in all college work. I'm proud not only to be a member of the RCDSO, but I'm grateful to have had the opportunity to serve on council this past term. And I would like to encourage each of you this evening to consider putting your name forward this election cycle.
Nancy, I thank you so much. I've seen you in a span of 2 years really blossom and engage at council meetings, and it's so wonderful to see. And you said it best, priority. Our patient is our priority, and we are a partnership. We all work together as dentists, as colleagues, with the college, because we all are, on that same mission. So I want to thank each and every one of you, Nal, Nancy, and Richard, for sharing your insights, your observations, and I hope that your colleagues have heard your words tonight and are encouraged to put their name forward for a position on either council or a non-council. So if anyone is interested, thank you very much. If anyone is interested in learning more about the upcoming elections, be sure to keep an eye out for emails from the college towards the end of August. And I hope this session has given you a bit more insight on the responsibilities, impact, and time commitment of these important roles. As promised, we wanted to take a few minutes to answer some questions that were sent in as part of the registration process for the event. So our first question comes from Lori Houston, who asks, is the college looking into environmental sustainability responsibility with respect to delivery of dental care in an endeavor to maintain protocol advocacy that is scientifically based and that addresses concerns with single-use waste, which has egregious repercussions for younger and future generations in terms of a planetary environment that is not being destroyed and causing future health issues. Thank you, Lori. The college is very much aware of this issue and recognizes its importance. Council members and stakeholders have recently raised this as an area of focus in our draft strategic plan, which is currently out for external consultation. If you wish to participate in that consultation to provide your feedback, you may do so by visiting the college's website and clicking on About the RCDSO Public Consultation section, or by visiting our Twitter page. So we anticipate more work in this important area in the future, but do not have a firm timeline. Once the new strategic plan is finalized, we'll look at developing priorities and formulating specific projects on this topic. Dan?
Next question comes from Homa Jamediabadi, and if I've pronounced that wrong, I apologize. Homa asks, I have heard from various colleagues that when they've complained to the college about issues such as improper advertising, among other things, the college has decided not to take any action. Is this true? And if so, what is the rationale? In September of last year, 2021, the council directed college staff to adopt a risk-based approach to advertising, and specifically to use that risk-based approach within the practice advisory service that we've talked about a few times this evening. This has definitely changed the approach that we're taking, in that the department is responding to certain advertising questions that have a minimal risk to the public. And at council's direction, the practice advisory service is only becoming directly involved in advertising inquiries or issues where there's a risk to the public. So there's various degrees of acceptability linked to public harm. And one recent example that we've seen in the media was mention of a clinic that was involved in fake patient reviews. Our risk framework helps us to deal with many of those scenarios, to determine how to analyze those specific issues. And the practice advisory service will be there to continue to answer clarification questions related to advertising and other issues that are related to dentistry in Ontario, and also information that you've heard that relate to our documents and regulations. But the staff within the practice advisory service are not going to be involved in some issues on a longer term basis. They won't be involved in some issues that relate to professional disputes that are related to advertising. So we're obviously interested in hearing about how this is working. This is an issue that takes a lot of college resources, and I remember talking to several groups last fall about the kind of resources that we do use in dealing with advertising inquiries. And using this risk-based approach not only helps us to devote resources in a proportionate way, but also hopefully to allow for some of the more public harm related advertising features to be addressed very directly by the college. Our next question was submitted by Mark Zadrayev, and again, if I've pronounced that incorrectly, I apologize. Mark asks, why does the RCDSO brag about protecting the public, but never stands to protect their own members that are paying the membership fees? And from that same fee, RCDSO employees are getting a salary. So thank you for the question, Mark. And I know Nalin identified some of the response earlier, as have others with respect to our mandate. But everything that the college does is to serve and protect the public interest. Remember that the college is governed by the laws of the province, by legislation, and it outlines what the college must do, and in some cases, what the college cannot do. So our mandate is to work in the public interest, and we do that by putting patient interests first and always. We protect the public's right to quality dental services by providing leadership to the profession. And patients must be able to put their trust somewhere. They must be able to put their trust in dentists. And when a patient visits their dentist, they obviously expect a trained, registered professional to provide that safe, ethical, and effective care. It's our responsibility to ensure that dentists have the qualifications that are necessary, both at the start of their practice career and also the required competencies as they move throughout their career. And the safe care of patients and the protection of patient rights is our first priority. It's really at the heart of everything that we do. And we do that with the profession. Obviously, we must make decisions with that lens of the public, but we have to have a profession that's firing on all cylinders. That's the ideal. And we need to ensure that we put our attention to and our focus to those areas that will help to reach that or get us closer to that ideal. So lots of supports that we provide to the profession that were mentioned earlier, and I won't repeat them. But really our job is to instill a level of confidence and trust in dentists and the care that they provide. It's not our role to advocate for the profession or to duplicate the role of the professional association. But we must work in tandem, and we must, as a college, always try to balance patient-centered care with the profession's ability to deliver that care. Sandy?
Okay, our next question is from Helen Chu. Helen asks, can we address how to deal with small complaints so it does not grow out of control? Many of the complaints the college sees are about communication with patients, their family members, and caregivers. In these instances, communication has often led to misunderstandings, confusion, and a sense of having been ignored or ill-informed, all of which have an impact on the dentist-patient relationship. There are ways to mitigate this before patient complaints are made to the college. Here are a few tactics you can employ in your practice. Listen carefully to the patient's concerns and answer their questions or their caregiver's questions directly. Patients are scared, vulnerable, and unsure, so be respectful and empathetic. Communicate clearly, avoid jargon, and use plain language. Build time in your schedule to communicate with patients. Make sure that the patient understands your diagnosis, reasons for the proposed treatment, the risks and benefits of any course of treatment, the costs involved, and the timing of any procedures. And document in accordance with the dental record keeping guidelines. Good dental records are so important. If a complaint is made about your practice, solid dental records will assist in understanding your informed consent discussions and record of patient communication, such as conversations, emails, etc., relevant to their care. An accurate, timely, and complete record can make a significant difference in a college investigation.
And our final question comes from George Botros, who asked, last year, you extended the education points to 1 more year. I did my 90 points in 3 years, so what am I to do with all of the points I did in the 4th year? Can I add them to the new 3-year cycle? Now, I'll try to answer this, and obviously, if you have more questions, please get in touch with me or the quality assurance area, and we can address your more specific needs. But in 2020, the 3-year CE cycle, continuing education cycle, was extended by 1 year because of the COVID-19 pandemic and the closure of all events, including live in-person continuing education courses. The extension was to allow all dentists extra time to accumulate their CE points and to be as fair as possible to all dentists. CE points must be claimed in the CE cycle in which they were completed. And this is reflected in the date of any CE completion certification that members receive. The e-portfolio will not allow dates to be entered that are not within the cycle range. So the 2020 cycle happened to be 4 years long instead of 3 due to the extension. And 3 years, as you know, is the usual time frame. And this means that points cannot be carried over from that 4th year to the new 3-year cycle.
So thanks, Dan. A big thank you to everyone who submitted questions. It's important for us to be transparent about the work that we do, and answering these questions hopefully helps us demonstrate that openness and accountability.
And in the meantime, if you have other questions, please do not hesitate to reach out to staff at the college in the practice advisory service by email. and that's practiceadvisory@rcdso.org. They're there to help, and they are available to assist you with any of your practice-related questions or concerns. You can also follow the college, and I see now or realize now that there's a huge cohort that is not following us on Twitter or Instagram, but you can receive our latest news, updates, and resources that will help you in your practice as well. We'll be sending you an evaluation survey about this evening's session, and it will be short in recognition of your time commitments, but it will help us understand how to improve and make RCDSO Connect more valuable to you. And hopefully we were able to improve it based on the feedback that we received last fall from a similar event. The latest college newsletter is going to be arriving in your mailbox soon. I hope you'll take the opportunity to take a look at it and get more details on what the college is doing to meet our mandate and to serve the public interest. Before we leave for this evening, we did have a couple of final polling questions for you. So you'll see on your screen in a moment. The first question is, after hearing from council members, would you consider putting your name forward to join council or a committee? So great, I think we have about 175 still on the webinar. We've got about 40, just over 40 responses with a half and half split, which is probably to be expected. I mean, we're here to provide you with information that can help you with your decision making, but obviously you have your own context and your own issues that affect you on a day-to-day basis. So we're now up to about 60 people with probably just under 50%, 43% saying yes. So that's good. I see that as a success. We've been able to reach some of you with the kind of information that our council members provided. So just under 40% now. That's great. And we'll be able to tally these results and maintain them and get those back out to you as well. Our last polling question, come up on the screen. There it is. How comfortable do you feel now in reaching out to the college for help or guidance? So great, we've got about getting close to the number that we've had in terms of sample size. We're up just 60, just over 60. Lots of people, about 72%. Ish are comfortable or very comfortable. Well, as you continue to provide your responses, I hope that we can continue to provide you with the kind of initiatives that will help to build your level of comfort. And I've mentioned the new website as one, and also being able to provide you with information when you contact us by phone or by email. I'll turn it back over to Sandy for some final comments.
Thank you, Dan. So I'm personally grateful that so many of my colleagues attended this evening, and I hope you will continue to attend future events and provide feedback to the college on the evaluation survey Dan mentioned. I want to thank college staff in the background who have worked hard to put this event together. We are looking to host at least one more RCDSO Connect in the fall, so please stay tuned for more information on that in the coming weeks. Enjoy the rest of your evening, and thanks again for taking part. Good night, everyone.
Good night, everyone.